Hey besties, thanks so much for watching. I decided to make a video on nursing stuff, so just talking about everything nursing based off my nursing journey and experience. And so I thought that this might be a video for people who are either in nursing school trying to figure out what they want to do, or even newer nurses that have just graduated, or just any nurses in general that are curious about my journey. So if you are interested, then stay tuned and continue watching. Sorry guys, please excuse the background. It's a mess. I'm just sitting in my room just for a chill talk, but it is kind of messy, so hopefully it's not too distracting. But anyways, you're probably here because you're interested on my nursing journey and kind of how I got to where I am and the different obstacles that I went through. So kind of starting off, I started nursing school in 2017, I want to say. January of 2017, if I have that correctly. The journey to get to nursing school was quite crazy just because I didn't really understand how to get into a nursing program, and that pre-nursing was actually not getting into a nursing program. So I kind of did a lot of, I got pregnant and then I got myself back on track. So I started taking a lot of the prerequisite courses at community college. And then I applied to university. I got into like Sac State, San Jose State, East Bay, all of that for pre-nursing, which again, I didn't really know anyone at the time that was going through nursing school, and it's quite different than any other major. And so I thought I had gotten into a nursing program. So I was like super excited. So I made based on like financial stability and all of that, what made the most sense at the time was for us, or myself, my oldest son at the time, and then his dad. The best move for us was to move to Sacramento, just given our financial situation. It was much cheaper in Sacramento, and so we moved out there, and I was thinking that I got into a nursing program. So I was super excited just to find out that it was really just nothing. So anyways, spent a lot of wasted time there doing more prerequisite classes that I didn't realize I could have just done at community college. However, I did qualify for financial aid, so a lot of that was covered. Get to why that was a mistake later on, but not really a mistake, but I could have used it in a better way. And so finally I finished all my prerequisites, and then I realized I had to take the gosh, I'm blanking on what it was called. And think about it, it's been so long, but okay, so the exam that I was talking about was the TEAS test, TEAS. So you had to take this exam, and I heard that in high school, I didn't take, oh my God. So I heard it's very similar to that test. However, it was really, it was every subject. So like English, math, science, like every random thing. And I studied, but I don't think there was anything that can really prepare you for that. So I ended up scoring really poorly on the first one. I think I got like a 70-something%, and then I got like an 80-something. So I was like super defeated because I was like, oh my gosh, I'm not going to get into any nursing program. Nursing programs are super competitive. So especially in the Bay Area, and it was just not an option for me to go out of state for nursing school. And so I stick to applying to Bay Area schools. I did do well in my prerequisite classes. So I think I had like a high 3 something GPA. But at the time, you needed to have like 4.0, like 90s on your TEAS score to get into any like nursing school. So I was super stressed. I ended up getting into a private school, and it was super exciting, but then I had to move back to the Bay Area for it. And so that was also quite a journey, trying to figure out financially how that worked. So, private schools are super expensive, and going back to the financial aid aspect, I wish somebody would have told me that I would have gotten more with my, I think it was the Cal grant, if I had used it at private school, because that one is based off of how much the tuition is. And so had I saved some of that, but again, you know, hindsight 2020, because at the time I also needed the money to pay rent on my apartment, because that's when my son's father and I had split up, and you know, he was the only one working when we moved out there, and so I had to use that to pay for my rent in Sacramento. And luckily I had free childcare on campus at Sac State, which is really nice. So I really appreciated that, and that really helped me be able to study for all my exams and do well. So very, very thankful for that. So we moved out here back to the Bay Area, and I went to nursing school for the 2-year BSN program, and I started January 2017 and ended December of 2018, so fall, and I graduated December 2018. And I would say that I think nursing school is by far like it was one of the most stressful times of my life. I think being a mom and just having to balance, I think he was 4 or 5 at the time. And luckily I found free daycare out here, and preschool. I think it was daycare at first because he was 4, and then it transitioned to preschool, and then, you know, he went to kindergarten, which is really helpful all throughout my nursing journey in nursing, I think. And I was still working. I think at the time I was working at a apartment complex, pull out a large loan to go to this nursing school. Again, it was a private school, so tuition was much more expensive than I would say a state university. But again, going out of state was not, and I think that would cost more. It was just not an option for me. So I was really blessed to get in. Again, however, nursing school was very stressful. It was like almost, I would say there was like a lot of, I would compare it to like being in high school again, but like in a different way, where you're just kind of like, we're adults and we are all in the program and we are all aiming for the same goal. So like, why are we having so much drama? And it wasn't even like you wanted to be in the drama. Like you were just like, people would talk and then you would just be like inserted into the drama. Like, I feel like I just know that personally for myself, like I was just trying to stay in my lane, focus. And I think it's because everyone's just trying to do well on exams. And honestly, I feel like there was a lot of cheating going on. How that was possible, I don't know. But I think that was a huge portion of it, or like part of your group was actually studying, or not the group, your cohort was actually studying and trying to understand. And then the other part was just like trying to get the like Quizlets or whatever to pass and then get all the answers. So it was just a bunch of drama, and it was just insane to me. And I think personally, I felt like a lot of people, I mean, you look at me and you think that like, oh, she doesn't know anything. You know, look at her. I got judged. Like, I think people thought I was stupid. White people started talking a lot about me. And a lot of it I didn't even know until later, because these people like pretend to be your friend, but then you find out that they were talking behind your back later on, which is crazy. But if I could give you one tip, if you are about to be in nursing school or you are currently in nursing school, do not feed into the drama, number 1. Number 2, do not cheat. Like, you are going to be taking care of people's lives. Like, you need to take this seriously. And the fact that people were cheating to me was insane, because it's like, how are you going to do your job once you're done with school? Like, this is not one where you have a partner with you, or like you can cheat your way through, like where you're sitting behind a computer or something doing stuff. Like, you are in charge of people's lives. So if you're not paying attention, you are going to literally kill someone. And so to me, that's nuts. So don't cheat. That's number 2. And number 3, like, just focus on why you're there. Just do your own thing. If you have to, I feel like studying, like study by yourself. group settings are okay sometimes, but I feel like for the most part, like you should really just study by yourself. I found that I was the most productive independently studying and then testing my knowledge in a group setting where you can like quiz each other. I also became a tutor at my nursing school, and so being able to teach somebody else on a subject means that you understand the knowledge. So that was really nice. To be a tutor, and so I was able to kind of help other people. I know a lot of you are probably still looking at me like, girl, you were tutoring people. Yes, like I studied my ass off, and I think that's why I was so stressed. Like I still have some of my notes, and I literally remember things from nursing school, and I use it currently in my job today. I've heard from nursing students that are coming in that it's still very heavily drama. So just stay clear of it and do what you got to do. Laser focus. That's all I have to say. And then after I finished nursing school, it was like, oh, relief, right? Like you have to get through your clinicals. Another thing is, as a nursing student, in your clinical rotations, make sure that you are hands-on, go-getter. Do things, because that's the only experience you're going to get is in clinical rotation. You need that hands-on experience to take care of patients. You cannot go through nursing school and not touch a patient and expect to be a nurse and be comfortable as a nurse once you graduate and become a registered nurse. Like, be a go-getter. I think my number one pet peeve, because I feel like when I was a nursing student, I wanted to do everything. However, there are people that like hide and just try to get through the shift. But like, I wanted to try to do everything because I knew that that's the only time that I was going to get hands-on experience. So take your clinicals really seriously and just literally ask your nurses, like, what can I do to help? Because honestly, when you're busting your butt on the floor as a nurse, like anything helps. Like vitals from nursing students without having to ask is like amazing, at least in my opinion. And it's honestly one of my biggest pet peeves when there are nursing students, like first off, sitting at the nurses station, like taking up our stations to chart, not moving, and then also not volunteering to like do anything. I literally tell all my nursing students that I'm with, like, let me know if you want to do anything. Like, I am happy to let you do whatever. Just let me know. And I would say 90% of the time, shockingly, I get nothing. So my preceptor was hands down like one of the best preceptors you could ever wish for. She was patient. At the same time, she knew how to push you. And, as far as like patient load, like starting off slow and then, with your comfort level and just like easing your way. She was like so kind. I love her to death. She's so kind. And I really think that she was just like a blessing. And so she taught me, like, I would say everything that I know. And I literally cannot thank her. And I knew, I was like, I have to go back, and I'm going to go back there and I am going to work with her. And so now we are co-workers, and it's just like this amazing bond that we have. And I just like love her to death. So I appreciate her, and I'm so thankful that I had that opportunity to precept there. I did actually an internship over the summer. It was a paid internship. I applied, and I think maybe 6 of us got the internship, and I was lucky enough to get it in pediatrics, and that's when I first met her. And then they offered me to continue my preceptorship there in the fall. So I did a total of 6 months of 6 months, and I think, and to the point where I was like, everyone was like, oh yeah, we should just hire her when she graduates. Like, she doesn't need extra training or anything because she's been on the floor. I was just on my own, essentially, just with like supervision from her, where she would have to like sign off because she was the registered nurse at the time. So anyways, take your experience on the floor, like your hands-on experience, really seriously. I think that's really what gets you to become a really good nurse and make you feel confident and comfortable in your skills and like what you're capable of doing. And this is why I say that studying for the NCLEX, studying in nursing school is so important, and knowing the material, because if you the content, you're able to answer the questions. Because, like, for example, if you know the symptoms of right-sided and left-sided heart failure. So if you know the way that the anatomy of the heart, you know that the right side will, if you essentially think about it, backfill, right? So you're going to see edema, etc. And so that's kind of how I always answer these questions, right? So I would think about not only the anatomy, but the physiology and how things work in the body, right? So if you understand the disease process, it's the same thing. You can figure out the symptoms, you can figure out whatever it is to answer the questions. Like, I know people talked about, I know a lot of people were like, oh, UWorld was amazing. Like, it helped me. It helps you in a sense of getting a gauge for like how the questions are going to be asked. However, I don't think it can help you answer the questions, if that makes sense. Like, if you don't know anything about diabetes and there's questions about diabetes, like, I just can't understand how people are saying like, you know, UWorld helps you because, you know, it helps you choose the right answer. There is a such thing as good test takers, and there are a lot of them out there. But I think in the NCLEX, it's really important to just know your information, because I think if anything, that's what helped me the most. I did do practice questions on UWorld. I did Quizlets. I did, and I think going back to just studying my material from nursing school and my notes and all of that stuff is actually what helped me the most. Honestly, I can't say that UWorld helped, and I can't say that UWorld didn't help, because I did do it, but I just didn't feel like it was a significant reason as to why I passed. And I decided to actually take my NCLEX fairly quickly. I felt like the sooner I took it, the easier it would be, because you still have all of that knowledge when you graduate. You still have a lot of it. However, if you wait forever, you know, even if you're studying, I just feel like some of that just goes out the window. And so I graduated December of 2018, and I took mine February 5th of 2019. And I did that on my birthday because I was like, if I pass, like, that would be the best birthday gift like ever. And so, however, if I failed, it would be the complete opposite. And so I was just hoping that I was gonna pass. And so I think, yeah, so that ended up working in my favor. I took the test. I was so nervous, but going there, I just listened to music to kind of calm myself. And number one thing I learned too with test taking, at least for myself, is don't second guess yourself. Just if you see an answer, of course, you know, be smart about it, like read all your answers. But if you just know and your gut is telling you, just go with that answer, because that every time I would second guess myself, I would get it wrong. And so that was another thing I had to keep telling myself is like, that's the one I chose. Like, there's a reason I chose it. Like, you know the information, so go with your gut. And so I did actually pass in 75 questions. My computer just shut off. I was super nervous because I was like, oh, did I really do bad? But back in the day, they said if you get a whole bunch of like select all that apply questions on your multiple choice where there's multiple answers, that means you're doing well. And chances are that you are going to pass in 75. So I was trying to not let that get in my head. So if that happens to you, like, just keep going with the test. Don't think about, am I passing? Am I getting close to the end? Like, am I getting these for a reason? Because it's an adaptive test. At least the one I took is an adaptive test. So it's supposed to go with, like, if you're doing well, it's going to give you more harder questions. If you're not doing well or you need more questions in a different subject, they'll keep giving you more. So try not to let that get in your head, and so I think really just studying your material and understanding the knowledge and kind of just rationalizing things in your head when you are reading a question. You understand the material, don't second guess yourself, and hopefully that will help you pass your NCLEX. On to job hunting. Wow, that was definitely a shock for me. I do have to say I was kind of confident that I was going to be able to get into a new grad program, only because I did graduate with honors. I graduated summa cum laude. And so not only that, but then I passed my NCLEX fairly after graduating. And so I felt like, And then I had my preceptorship and my internship in peds. Like, it was like unheard of, right? Like, I was like, I have all this experience. I'm ready to just work. Like, why wouldn't anybody, like, I couldn't understand why nobody would even interview me for these new grad programs. And I heard a lot of it has to do with your resume. And so I think my resume wasn't in the systems. There's keywords that your resume has to have for it to like make it through the like automated or computerized portion before it actually gets to HR. And so I think I was probably not hitting those keywords. I actually did hire someone to help me with a resume, but I don't know what it was. Like, I wasn't getting any calls. Like, I applied everywhere religiously to the point where I was like, okay, it's already been, I can't wait months. Like, some people might have the luxury to wait months and months and get into their dream job and dream program. But I was like, I just didn't have that time financially. I was like, I have to start paying off these loans. And, I have a kid to take care of. I have a life to live. I didn't have any other help. Like, my mom passed away when I was 10, and then my dad was at the time sick with Parkinson's, and we also, there's a long history behind that, but my brother was actually paying for him to live in a home, and so obviously we were so young, couldn't take care of him, so at least for around the clock care that he needed. And so I didn't have any extra financial help. Luckily, my husband now saved up and was able to pay off a lump sum of part of my loans. He was able to pay off, luckily, like 30 grand of my loans for me, because I had, at the end of it, I had like 100 grand in loans because I pulled out those extra loans to pay for like rent in the Bay Area, groceries, just like life bills, etc. And, having a kid, it's like, it was tough. It was really, really tough. And so, yeah, I had 100 grand in debt and he paid off 30 grand. So I was able to refinance the rest. Luckily, my credit was good, but I didn't have the income to support at the time. And so, I did, and I refinanced, and I can talk about that in a different video. And so I had to just kind of take what was available. And so I did the unconventional route and did not do a new grad program. I also wasn't able to get into where I precepted an internet because it wasn't up to the manager. It was up to the director. And at the time, the director was not okay with it, just because I think from a budget standpoint, they were like, we can't hire on a new grad. There's no new grad programs there. So that was kind of the situation. It was really a bummer, but hey, I'm back there now. And there's always a way. Like, if you are determined, like, don't get discouraged. I think that's the biggest thing is when you're getting rejected or you're not getting calls back, like, you can't be discouraged. Like, you just have to keep, again, moving forward. Like, life doesn't stop for this kind of stuff. So it's like, if you're in a position like I was where you just couldn't, wait, like, you just can't wait, just get into what you can get into. Like, they always say, like, oh, you're not going to get into bedside if you take a outpatient position, etc., etc. Like, that's a complete lie, because again, I took a very unconventional route, and I actually did school nursing for 3 months because I needed some income. And then I started, I did school nursing, and then I got a call from a recruiter, because at the time I was still applying, mind you. Even though I was working, I was still applying like every day to hospitals, any position, any staff nurse 1 positions, like not even just new grad programs. And so, sorry, I was like, what is that? That's weird. My door just opened. Okay. So yeah, again, any position, just apply. So then I got a call from a recruiter to work at a peds clinic. Mind you, this is all peds. I stuck in the same specialty because I think if you want to be in a specialty, it's best if you could stay at least within that population. So it was a peds clinic. It was for a triage position. So at the time I was like, oh, is it going to be like, what kind of triage, I didn't understand at the time, but it was actually just phone triage. However, again, every experience is going to benefit you in some way. You will use that experience along the way. Like school nursing, my job was to take care of a diabetic child, and manage highs, lows, etc. And then I decided to help in the special needs classroom, where I would do G-tube feeds, seizure management, all of that kind of stuff with the developmentally delayed kids. So I still use the stuff today. And it was nice because I learned how to use like insulin pumps, etc. And so you don't really see that in the hospital, but because I have that knowledge from the clinic, like, it makes sense. So then I did the triage. And so they give you this like whole book on how to, triage the patient. Would come in, you would get calls, and you kind of like, you're like advice nurse, but then also determining if they need to come into the clinic to be seen, emergency room, etc. So that's why it was considered triage. And I actually learned a lot, and I didn't actually use the book. I felt like that one, I know a lot of phone advice nurse positions, you have to follow the book. This one was kind of nice. I had freedom to ask my own questions and kind of assess in my own way. And I felt like that was really nice, because it's really hard to like, the family is telling you symptoms or whatever, and you're like trying to flip through a book. Like, it just didn't work for me. So it was really nice that I didn't have to like stick to a script and like really just use my own knowledge. We gave vaccines here and there, IM, antibiotics. I think, we had to straight cath for urine specimens, like maybe a handful of times while I was there. And I was there for less than a year, I would say, before I got a call. So I actually applied, like I said, to just all positions, like not just new grad positions. And so I actually got a call from a hospital, and it was not a new grad, but it was inpatient pediatrics. And, I was so excited. I went for the interview. I had a portfolio. So it's really big to bring a portfolio to your new grad interviews. However, I made a portfolio anyways for this interview because I wanted to highlight my strengths, especially because, I was still a new nurse, technically a new grad, and I wanted to highlight what my strengths were and how I did in school so that I could show that, why I should deserve to have this position. So I went for the interview, and I genuinely thought that I didn't get the job because it was maybe like 10-15 minutes long, and I felt like, she was like on her phone, so I kind of felt like she wasn't interested in me, and I was just like, this is really awkward, like, why would you bring me in for an interview if you're not even like interested? And so I was kind of bummed when I left. I was like, oh, like, I for sure didn't get that. She wasn't even paying attention to me. Like, I didn't really feel like it. And then it was like, I think I followed up. So I didn't hear anything. I was stressed about it. I was just like, oh my God, that was like my only chance of getting into a hospital. And I was so stressed about it. I remember I would talk to my coworker like all the time. I'm like, do you think like, why do you think they haven't called me? I'm just like a stressor though. I stress about so many things, but, yeah. And then, so I decided to call while I was on break with my coworker. She was like super cool, super sweet. And so I did it with her for moral support, and I called to follow up with the manager, and she was like, hey, I was actually just running through your references and, calling them. And I was actually going to call you, to offer you the position. And I was just like, oh my God, to say the least. Like, I was so freaking happy. Like, when you get your first job, it is like not your first job, but like your first, I felt like real nursing job to me. That's how it felt, but not to discount anybody else's nursing. But I was just thrilled. Like, it was what I wanted, and I knew it was one step closer to getting me to where I wanted to be, back where I was precepting. I needed a year of experience to get back. And so I stayed at this place for about a year and a half, I want to say, something like that. And So I think I was there for like a little over a year. But again, I used my experience from my preceptorship, internship, everything. Again, my hands-on experience. This was not a new grad program, so there was no extensive training. I think I maybe got like 8 weeks of orientation versus the norm. But honestly, it was like I had to do my own assessments based off, everything. It's not like you're being taught anything. So you're being a nurse. So I would say, again, if you're going to take an unconventional route like I did, you really need to know your stuff. And I just got in there. Like, I just had to get back in it and do hands-on and all of that good stuff, because that's just how I learn and do things. And I actually did night shift there. It was really hard to adjust. Honestly, not ideal, but that's all they had available, and I wasn't going to say no. So I did that. And then I finally, after applying, I got into where I wanted to be, which is where I am now. And I got back to where, again, where I precepted, etc. And it was really nice because I like knew most of the people already. And however, the acuity was much higher. I forgot to mention at the first job that I got before that one, inpatient, I actually got my APON certification right away. That's the certification to provide chemotherapy and biotherapy. And so I did that there. And then when I got to my current job now, I think it was like about 6 months before I went through their training, and it was much more extensive than about 4 years now. And obviously I plan to probably stay here. I did work per diem at the other job for a little while in 2023. No. Yeah, 2023. It was like right before summer of 2023. I worked per diem because we bought a house and I just wanted to earn a little bit of extra money. And so I worked per diem there just for a little bit. I did it for maybe a few months before I actually quit, because there was a lot of family stuff going on. My husband's grandma was diagnosed with cancer, so I was helping a lot with that. And so I was pregnant at the time, and it was just a lot of stress on my body, I felt like, and I was just really tired trying to balance. And again, my current job, the acuity and everything is a lot higher, and it's more exhausting, put it that way. So I ended up having to quit, not intentionally. I didn't plan to quit that per diem job until I had the baby, and even then I didn't think I was going to quit, but it was just too much to balance at the time. And so now I am where I want to be, and the benefits are good, pay is good. However, I've come to realize that, it's not perfect, obviously. I'm not close to perfect, I'll say. And working at different places, you realize that every hospital is going to have its own downfall in its own way. Like, there's pros and cons to everywhere, and I think that, it's just more about patient safety, just making sure your patients are safe. And again, that's why I say, please pay attention to your material that you're learning, because these are people's lives that are going to be in your hands. And we've had a lot of times where it's really important. And if you miss something, that could determine the outcome of the patient. And I just think about it on these new nursing students are honestly not what I imagined. They're the complete opposite, I felt of how I felt, and very hands off. I don't want to say scared, but very hands off, not go-getter. And it kind of scares a lot of us, because we're just kind of well, these are the nurses that will be taking care of us. And it is kind of scary. Some of them, it's just, I don't want to talk bad about anyone. I know nursing school is really hard, but that's why I say take every opportunity you can. I try to stress, have these students do every little thing, simple things. I'm do you want to do this? Because that's how I learned how to use pumps, give meds, lab draws, using G-tube, giving G-tube medications, NG, except putting NG tubes in, etc. And so I think this is really your opportunity to kind of get in there and get your experience, so that when you're hitting the floor, you're not like you by yourself. So that's why you need to know what you're doing, and always ask for help. Like, that is my thing, is anytime I didn't know anything, or currently, even if I don't know something, like, I have no shame in asking for help, how to do something, what is the policy, etc. Because again, like, if you don't speak up and people don't know that you have questions, like, you're going to end up making an error. And I've seen it happen at my old job where, you know, the nurse was kind of new and made a mistake that wouldn't be life-threatening, detrimental, but like could have caused some type of reaction, you know? So it's very scary. Like, we are taking care of people. This is not a joke. It's not a way that you could cheat through it. There's no cheat code. Like, you need to just know your stuff. And I think, like, really nailing your assessments, you know how they say with more years of experience, you just know when something is off. Like, hands down, this is true. And always go with your gut. Because now, you know, like, I feel like even I'm at a point where I can walk into a room and know that this patient doesn't look right. I don't even have to listen to them. I just know that they don't look right. So yeah, that's my main thing, is just really pay attention, and you will get to where you want to be. Like, just stay determined and stay the route and don't give up. And I think really just know and be confident in your abilities and take things seriously. Sorry, my camera is giving me a warning that it's overheating, so I don't know how long this video is, but yes, like, you can do it. And if you really, yeah, just don't be discouraged. You can do it. It may not be what you envisioned, and it may not be, again, the conventional route, but you'll still get to where you want to get to as long as you put your mind to it. So just be positive, especially during this nursing journey. I know it's really hard, and it can really bring you down and make you depressed and all of that, you know, make you feel all the feels. But when you get there, I promise it feels so good. And I honestly love my job. Genuinely, I love my job. It gets crazy, but I genuinely love what I do. And I think that's the most important thing. You cannot do this job for the money. You have to love your job, because you will never feel like you're paid enough otherwise. And you will feel burnt out. And yeah. And so if you, yeah, I mean, just be confident, stick to your guns. And I hope you guys enjoyed this video. If you want more videos on nursing related content, or if you have questions, whatever, please feel free to drop it in the comment box down below. I'm happy to do more of these videos if this is something that you guys are interested in. It was fun for me, so yes. Yeah, I'm happy to do more. Or if you have other suggestions, let me know. Otherwise, thank you so much for watching, and I will see you soon.